Well, it's happening for a couple reasons. If you look at the biggest gap we have, it's the number of plan sponsors who can actually track their pharmacy spend under the medical benefit, and currently it's less than 20% can do that. And it's happening primarily because the PBMs don't have the systems or the priorities around their product development to integrate the medical data on a routine basis so that the plan sponsors can actually see their specialty spend under pharmacy. The second big area is around the medication adherence. It's still about 50% of plan sponsors really can't see medication adherence for their specialty patients. And I think that's just actually an evolution of probably some of the smaller PBMs getting their reporting and their clinical programs in place where they can really do the outcomes tracking around specialty. So I expect that gap actually to close pretty quickly relative to the first one.
Okay, what are we finding around cost sharing in the next few years based on this report?
Well, currently we found that about a little over half of health plans actually have a separate fourth tier for specialty medications and about a third of employers. So that's actually a pretty big growth in the last few years. I actually think that number is probably going to double. Maybe even in the next 3 years, where we're going to see probably 70% of health plans and 60 to 70% employers putting in a fourth tier for specialty drugs, and that's going to be a higher tier. The challenge with that is we are just at the tip of the iceberg in understanding what really is the price sensitivity around specialty medications as you get to these much higher cost sharing levels, and of course then what is the implication in terms of medical outcomes. The movement to higher tiers is really ahead of the research, so that's going to be a very important area for researchers to investigate in the next few years.